There's a lot of antecedential evidence that this is something we should study more. Forgive the pun, but there's probably some fire where there's smoke, and we should investigate the medicinal use of marijuana or its components. This came from Dr. Michael J. Botswick of Mayo Clinic after a New England Journal of Medicine poll was released, stating that 76% of all votes by doctors were in favor of the use of marijuana in the medical field. Marijuana is said to have natural healing effects of people. Therefore, more and more people are believing that its use in medicine could be extremely beneficial. Today, I will be talking about what medical marijuana is, what it is used for, along with its side effects and risks, and lastly, how doctors have responded to the controversial drug. Marijuana, or cannabis, is typically thought of as a recreational drug. However, for thousands of years, it has been used for medicine. The drug is derived from the family of plants that include hemp. Recreationally, marijuana is illegal in all but a handful of states, but many states have legalized it for medical purposes. The FDA has not yet approved the drug as a medicine. Mayo Clinic stated on August 25, 2006 that marijuana contains at least 60 chemicals called cannabinoids. Researchers are evaluating how effective some of these cannabinoids might be in controlling symptoms of certain medical conditions. The pharmacology ingredient in marijuana is a mind-altering drug called THC. According to the National Institute on Drug Abuse, in 2013, the average THC content was 9.6% compared to 3.7% in 1990. When THC enters the body, it stimulates cannabinoid receptors in the brain, which stimulate the body in various ways. Some of its effects include reduced pain and increased appetite. Marijuana also contains the chemical cannabidiol, or CBD, which also has beneficial health effects. This chemical isn't psychoactive like THC and will not cause intoxicating effects. According to the NIDA, CBD can possibly be used as a treatment for childhood epilepsy. It also possibly could be used for an oil for healing tests, but more research must be done on the chemical. California was the first state to legalize marijuana in 1996 when it passed the Compassionate Use Act. This allows the possession and cultivation of marijuana for medical purposes only upon doctor recommendation. Most states require written documentation from a person's doctor affirming that the person suffers from a debilitating condition and might benefit from the use of medical marijuana. Next, I will be talking about the different uses marijuana has in the medical field. Medical marijuana is used to relieve symptoms. It is not used to treat or cure diseases. It won't change certain outcomes, but it will ease certain symptoms, make you feel better, and improve your quality of life. According to the California Medical Association, as released in August 2016, cannabis is most effective in treating chronic neuropathic pain caused from nerve injury or disease. Marijuana typically makes you hungry, which makes it useful in treating conditions or side effects of diseases that cause a loss of appetite. As researchers continue to study the benefits of marijuana, they concluded that it may be effective in treating chronic pain, nausea, and muscle spasms, especially those associated with certain conditions such as multiple sclerosis. The CMA states that marijuana also may help treat AIDS, anorexia, arthritis, cachexia, cancer, chronic pain, glaucoma, migraine, persistent muscle spasms, seizures, severe nausea, and other chronic persistent medical symptoms that limit your ability to conduct major activities in life. In cancer studies, they have shown that marijuana extracts kill certain cancer cells, while others show that they may stop cancer growth. THC, the psychoactive ingredient in marijuana, improve the impact of radiation and also help prevent the nausea that often comes with chemotherapy treatments. As far back as the 1800s, cannabinoids were widely used as a pain reliever. Some medicines based off cannabinoids, such as Sativex, were tested on multiple sclerosis patients. The drug has been approved for use in Canada and in some European countries. In a trial involving 56 human patients, scientists saw a 30% reduction of pain in those who used medical marijuana. Along with the benefits that marijuana has, does come some risk. A possible risk is addiction. The debate over whether cannabis is physically or psychologically addictive is ongoing, and the NIDA suggests that 30% of users may become addicted. People who smoke marijuana before the age of 18 are 4 to 7 times more likely to become addicted than those who are adults. If you become dependent, withdrawal symptoms may include irritability, insomnia, mood difficulties, decreased appetite, physical discomfort, nausea, and restlessness. Researchers are split in the debate over whether smoking marijuana can lead to COPD and lung cancers. According to the National Cancer Institute, some possible side effects of marijuana usage could include increased heart rate, low blood pressure, dizziness, short-term reduced memory, short-term attention span, and decreased problem-solving skills. Some cognitive effects also include impaired memory, sense of time, reaction, speaking, and sensory perception. Medical marijuana is administered by either smoking, baking into foods, or taken orally in synthetic forms such as Dronabinol or Nabilone. Lastly, I will be talking about the doctor's reactions to the controversial usage of marijuana as a form of medicine. According to a New England Journal of Medicine study done in May of 2013, 76% of doctors were in favor of the use of marijuana for medical purposes. This included responses from 1,446 doctors from 72 different countries and 56 different states and provinces in North America. With that being said, as of right now, 19 states and the District of Columbia have legalized the drug under doctor prescription. Those who were in favor talked a lot about the responsibilities of caregivers to minimize their patient's suffering and also pointed out the knowledge of personal cases where marijuana was used to help a patient. Ones who were opposed to the usage of marijuana pointed out the lack of evidence, uncertainty as to where the marijuana was coming from, and problems with side effects and dosing. After doing my study for this class, I was able to conclude that the majority of people agreed with the usage of marijuana only if it was for medical purposes. In conclusion, I hope you have learned about what medical marijuana is, what its uses are, and how doctors feel about the use of medical marijuana.